Hi, my name is Greg Fell. I'm Director of Public Health in Sheffield. This is a situation report dated today, the 14th of December. So epidemiology-wise, some signs that R0 is beginning to increase, perhaps a bit too early to call. It's too high. It's lower in Yorkshire than elsewhere. The UK figure for R0 is between 0.9 and 1, and for Yorkshire it's between 0.7 and 0.9, so that's good news. 7-day rate is 130 per 100,000, and importantly it's continuing to fall, and it's continuing to fall in the elderly. But, and it's a hugely important but, the rate of that decline is beginning to level off, and there are some signs that that might start to go back up, both for the whole population 7-day rate and for the elderly age-specific rate, which is clearly the group that we're most concerned about, because they're the people who are most likely to be seriously ill. All up, epidemiology-wise, in terms of looking at all the data, there are some signs that the impact of lockdown is wearing off. We're probably getting to the bottom limits of what we can expect Tier 3 level restrictions to do for us, and there are some signs that the mobility data is going up. We're becoming more mobile, and mobility is a sort of a precursor for infection, because mobility means that we'll meet more people as we're more mobile. Hospitals-wise are busy. The percentage of beds with a person with COVID in them is falling, but very, very slowly. We've got a lot of people in hospital who have complex illness, who may not have survived in the summer, but we've got much better treatments now, and obviously that's really good, but that does mean that there are a lot of people with some really quite complex medical conditions in there. So thus they will be in hospital for a long time, and the rate of decline of hospitalisation because of COVID is very, very slow. So we have an R0 that's lower than 1, and lower in Yorkshire than elsewhere, but still too high for comfort. Significant slowing of the rate of fall of 7-day infection, both for the whole population and for the elderly, and some signs that mobility is starting to increase, and Christmas is coming. Household transmission remains the key concern, and social mixing within household transmission is obviously where the business end of this is. And Christmas will mean that more of us will mix with more households. There's no doubt about that there. So epidemiology-wise, it's a quite dangerous time. The rates are too high, and certainly too high for comfort, and the recent improvement is beginning to slow down and level off. So whilst the rules around Christmas have established what I can do, the consideration that I'm putting for myself is what should I be doing and what are the risks. We all think that if we catch this infection, it will be from a stranger outside the home. The converse is actually true. Having a safe Christmas becomes really, really important. So limiting the number of social contacts, being really strict about bubbles and making them as small as possible. The underlying concept is the more people from more households that mix with each other, the greater the chance of an infection, that turns into an outbreak, that turns into a bigger outbreak. We've all seen how infectious the illness is. We can reduce the risk in our houses: hand washing, washing surfaces, particularly high touch point surfaces, ventilation, open the windows. Does it have to be outdoors, or does it have to be indoors, or can it be outdoors? Limiting the number of times, limiting the amount of time that we spend with people, all can reduce the risk of infection. They can't eliminate the risk of infection. Underlying all of it is, if you have symptoms, stay at home and don't invite visitors. Stay at home means stay at home, and it doesn't mean go out or invite others into your household, because obviously that's the highest likelihood of transmission is during the time that you've got symptoms. So a large number of people taking relatively small risks can have a much bigger impact than a small number of significant rule breakers. We all like to grumble about those who are flagrantly breaking the rules, but it's the large number of people that take really small risks that will probably amount to much more transmission than a relatively small number of people. So epidemiology-wise, it's quite a dangerous time. The rate of improvement the recent rate of improvement is beginning to slow up, and that causes me great concern. Christmas is coming. Do celebrate Christmas, but celebrate Christmas as safely as possible, and we've put a range of information up on our website on how to do that.